Welcome to Computer Talk's Pharmacy Forward program. I'm Maggie Lockwood, VP of Computer Talk, and today our guest is Paul Baldwin, Principal of Baldwin Health Policy Group. He's a 30-year veteran of policy and government relations, so welcome, Paul. And today we're going to talk about your upcoming article on telehealth, which we actually discussed in January before all of this happened, and now it seems very appropriate that it's something you've written about and can talk about.
Yeah, thanks, Maggie. It's great to be here. Since we're all hunkered down now and preoccupied with COVID-19, and this is sort of one of those issues that we think about, and then all of a sudden, the world changes and it becomes more and more appropriate and relevant as the time passes. So one of the things we had talked about, I think you and I had talked about, and the industry's been sort of talking about at a low level over the past several years, is the role of telehealth in delivering care, especially to the Medicare population.
Mm-hmm. Yes.
And CMS has been engaged in promoting telehealth, but they've been sort of doing it, I think, in sort of a baby step fashion, trying it in different venues and under different circumstances. And all of a sudden, we have a healthcare crisis, which is overwhelming health systems. And its providers are now being asked to do several different things. And one of the things that CMS did was to sort of take down a lot of the barriers, at least during the COVID crisis, to try to use telehealth in more different settings and in more different kinds of circumstances. So one of the things historically in long-term care is that the long-term care community has been relatively slow to take up telehealth, primarily because the rules of Medicare require that a physician, when he or she makes a visit to a long-term care resident under Medicare or Medicaid, it has to be an in-person visit.
Mm-hmm.
And that was, it made telehealth sort of an abstraction because it really didn't fit in so well with the rules. The places that it did fit in were, in those situations where you would rather not transport a patient to a hospital, and if you could get a physician on the phone and actually have a hookup where a physician could evaluate a patient remotely, then it would be a valuable service. But until then, up until now, that didn't happen all that frequently. So long-term care environment has been relatively slow to adopt. And I think the fact that we're all engaged with trying to understand how the new payment system works has kind of crowded out the issue of telehealth. But now we find ourselves in a position where CMS has said, we don't really need to have those regular physician visits of long-term care residents conducted in person. They're enabling it to happen with telehealth. So this is, I think, right now people, I think, are trying to respond to that and try to engage with systems that they don't have a lot of familiarity with, at the same time that everyone else is trying to do the same thing. So, because, you can think of many scenarios in which telehealth would be valuable. The patient in a facility that, is ending up in distress at 3 o'clock in the morning, and a physician may not be physically available to come out to the facility. The only option that the facility has is to transport them to an emergency room. But if they have a well-developed telehealth program, then they'll be able to hook up a physician to actually do some observation, ask some questions, and then make a decision that, this is either worthy of a trip to the emergency room, or we can take measures short of that. So that's sort of a long-term implication of facilities becoming familiar with the telehealth option.
Well, and that's interesting. Having the technology set up, having the system set up, having it be secure. That's sort of an issue too. People they don't use it. They're not familiar with it. So it's not their first go-to option in most situations, and maybe that will change going forward.
No, that's exactly the question. In fact, I never used Zoom until yesterday, actually. So this is, we're all becoming familiar with new technology, and we do it under a sort of crisis situation when we actually have to do it. It's not like we can, in some cases, it's not going to be a situation where we can dip our big toe into the water and then kind of inch our way into it. We're kind of thrown into the deep end of the pool and asked to swim and, adapt to new technology fairly quickly. We talk to pharmacists a lot, obviously. I mean, Computer Talk is a pharmacy publication primarily. And so we're talking to pharmacy. And I think the question now arises, well, what about telepharmacy? I mean, is telepharmacy now going to become a mainstream technology for us to deal with patients remotely? And this is kind of a different case because telepharmacy operates under a rubric of state practice laws. So, roughly, according to the latest research, roughly 2/3 of the states have adopted some form of telepharmacy regulation, and they allow the boards of pharmacy to regulate that. But they regulate it, differently. Some of it has to do with how, can we dispense remotely? Can we consult remotely? And there's instructed in some states to limit telepharmacy to pharmacies that are really sort of in the boondocks and don't have a lot of other pharmacies locally, and kind of extend pharmacy services that way.
Right.
But
that was sort of the original when it started for pharmacy. At least it was those rural, hard to reach patients. That was sort of who it was targeted for.
Right. Exactly. Yeah. And I think that's the way it started, and then it hasn't progressed a lot since then. But I think the real opportunity in this telehealth arena is going to be with Medicare Advantage programs. Now, consider that CMS really wants Medicare Advantage programs to be able to use unique and creative programs to be able to reach out to their members and provide services that helps keep them out of higher cost venues like hospitals and nursing homes or whatever. So if we see a resident who's in a home and community-based care program under Medicaid, or is in maybe assisted living facility that is under, and the patient happens to be under under a managed care type program. The managed care program is being encouraged by Medicare and Medicaid to be creative in the way they apply technology and additional services. So under a Medicare Advantage program, a pharmacy could go to a health provider and say, or a health insurer and say, listen, I can do remote medication management. I can do, essentially the equivalent of a drug regimen review that happens in a nursing home. I can do that remotely. And we think we have I think this is a valid claim that pharmacy can intervene in a way that helps keep patients out of trouble with medications by either over medication or non-adherence or all the kind of things that make medication misadventures such an expensive problem. So, one of the things that I thought was really interesting in my research on this is that fewer than 10% prior to the COVID crisis, fewer than 10% of American consumers had any experience at all with telehealth. But those who did had a very high satisfaction rate. So it's one thing to say, I've never really used telehealth. It's kind of an interesting idea. But those who actually were sort of early adopters and tried it were really enthusiastic about it. And I'm thinking now that more and more people are going to be almost forced to expose themselves to telehealth. I think we'll probably have a lot more enthusiasm for it if the system doesn't fail. And right now we've heard stories about cases where people have been forced almost to go to telehealth, have not been able to get through, not been able to get an online appointment with a physician or a healthcare provider, and have become frustrated in the process. So, sometimes when the demand ramps up so quickly, we're going to see patients who are saying, I tried telehealth during the COVID crisis, and, it was just a nightmare. I'm never going back. And then there are going to be some patients who just say, hey, the experience was great. It saved me a trip. I don't have to go outside and be exposed to all the pathogens in the physician's office. and I'm going to do this more and more. So, that's going to be really an interesting thing, is what the experience it turns out to be like, and how the popularity expands or doesn't.
It's unfolding.
Yeah,
we don't know the end yet.
Right.
Well, thank you. And then if people want to learn more about you, where can they go to find out about you?
Yeah, we have a website dedicated to long-term care pharmacy. It's ltcpharmacy.net. We have a newsletter. We invite you to subscribe. It's free, and we'll be adding discussion services, and we're working on a couple of other projects. We'll update you on the website, but we'd love to hear from you, and let's see what happens as we go forward.